Well, that was quick. Welcome, everyone, to the August 10th, 2020 meeting. We will call to order the school board meeting and have the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thanks, everyone, once again, for the board and audience members. I appreciate the encouraging social distancing and wearing of masks as we look to open our schools and set a good example for others. Moving down our agenda, item 2 is the approval of the agenda. Do we have a motion and a second? Doug moved approval. Eric seconded. All those in favor signify by saying aye.
Aye.
All those opposed, same sign. Motion carries. Next item on our agenda is the approval of minutes. We'll take one at a time, the first one being July 13th, 2020. Can I get a motion and a second to approve those minutes unless there's any correction?
Second.
We'll have Bill as the first motion and Jackie as the second. All those in favor of approving the July 13th minutes signify by saying aye. Aye. All those opposed, same sign. Motion carried. July 28th, 2020 minutes. Do we have a motion for approval?
So moved.
Mr. Douthit. A second? Cynthia. Thank you. All those in favor of approval of the July 28th meeting minutes signify by saying aye. All those opposed, same sign. Motion carries. And the August 3rd, 2020 minutes. Do I have a motion?
I'll motion.
Jackie is our motion. Second. Doug, thank you. All those in favor signify by saying aye. All those opposed, same sign. Motion carries. Okay. Next, we have reached our citizen comment section on non-agenda items. Are there any citizens wishing to make a comment at this time? Seeing none, we'll move on to superintendent's recommendations for discussion. School board norms. Chris, would you mind reading those?
The norms are to be prepared, be on time, value and respect each other, exercise thoughtful deliberation and conversation, be professional at the board table and when visiting with the general public, speak up when norms are not being followed, advocate on behalf of students and keep the community in mind, and then we have the governance and other as well. If you'd like, I can read those otherwise.
That's okay, thank you.
Thank you.
Moving on to item B, school reopening update. Dr. Brenner.
Thank you, Madam President, members of the board. First of all, I just want to acknowledge out of the gate tonight that we do have some representation from public health. Sean McBride is here, our epidemiologist, Teresa Knox, nursing and nutrition supervisor, and also Ashley Nelson, who is in charge of contact tracing. So we want to thank them for their partnership, and they're probably thinking, what kind of partnership is this? You guys have to come to our meetings all the time, and we don't attend any of yours. So I want to thank you very much for being here, and they might be helpful in our conversation as we talk about our school restart and also about athletics. First of all, with our school reopening update, the second round of surveys that parents are completing closes tonight at 11:59 p.m. And to date, just looking at the raw data, about 18%, 18% of pre-K through 12 parents want to keep their students home. We'll do more analysis tomorrow after the survey closes. Additionally, staff surveys closed on Sunday night. We have a small number of teachers and support staff with a medical certificate to work remotely, and we will be calling upon others to assume the role of distance learning teachers. And there seems to be a number of people who want to step forward and serve in that role, teaching remotely, that is. So we're going to use the next few days for data analysis to find out where the gaps and overlaps are with the number of students involved in distance learning and the number of teachers and support staff available to teach grade level at the elementary level and or content level at the middle and high school levels. Further, we're exploring adding possibly more support staff at the school level to manage a quarantine room, if you want to call it that, for students who come down to the office who are displaying some symptoms. These positions would be at the paraprofessional level and coded under COVID, and they would also assist us with contact tracing. More details still need to be worked out, but just wanted to offer that as some new information as we prepare for students to come back on August 31st. And some updated information from the North Dakota Department of Health that we've wanted to clarify over the last couple of meetings has been clarified, and we are updating that document to our website. Additionally, there have been some questions about what's this online academy all about from a distance learning perspective, and that simply is a platform that we've been using for the last 4 to 5 years called Edmentum, and it offers a menu of courses in the event that we don't have teaching staff to support some of the distance learning components. So we do have that in place. Busing, we have some good news on busing. I talked to Chris Arnold late last week. He's been working through some scenarios with Dietrich, and John from Dietrich, who is the manager there, has worked out a plan that appears to be palatable to get all of our ridership to and from school without too much of a delay. We have some space issues that we're trying to reconcile. We know that not every classroom is the same size based on the measurements that we did in preparation for students to return. Now that principals are back under contract and teachers' key fobs were activated today, we have more people in the building and probably generating more questions than perhaps answers right now, but we're working through those situations at each of our campuses. So with that, I would pause there. Ms. Galach, Mr. Thompson, do you have anything else you would like to add at this time, or would you like to just open it up for questions?
Seeing nonverbal signals, I will open it up for questions regarding the school reopening update. Go ahead.
I know you're looking at this and probably haven't had a chance, but I'm assuming the 18% is probably uniformly spread, but I'm wondering if you get a big hit in one classroom or one grade at a certain school, is it possible that we may have to adjust boundaries or have students go to other schools because we don't have enough students or have too many or something? And I'm sure we're hoping that doesn't happen. I'm just wondering about it.
I can speak for elementary, Dr. Lund. No, what we're actually hoping is that when we have some of those families that choose distance learning at specific grade levels, we may be able to right-size some of those school positions and use those teachers that have volunteered to do distance learning for us. But as far as changing boundaries or anything that drastic, no, that's not in the plans at this point.
Thank you.
Admittedly, I do not remember where we left off last meeting on this topic, but regarding travel, I think we were still waiting for some feedback maybe from someone, if we're going to have any kind of, I guess, conditions if someone travels out of state or to a hot spot at all.
I'll go ahead. Yeah, thank you, Catherine. We're going to ask staff to follow the North Dakota guidelines, public health guidelines if they travel, but I will be putting out an announcement encouraging staff not to travel out of state, in particular to any hotspots 2 weeks before school. We can't mandate that, but it will be an ask from my office.
Will we have something similar sent out to parents or any kind of information along those lines?
We can encourage that, and I'm smiling under my mask in case you can't see that, but we can encourage that, but ultimately it is up to the parents.
I'm wondering if somebody from public health has any comments about that. I'm not thinking so much at the start of school, but I'm wondering in early January after the holidays when people travel, if if public health has any comments, or if the state health department has any guidance, like we know in other states where they've said, well, if you come from this state, you have to be quarantined for 14 days. I'm wondering if you guys have any thoughts on that.
At this time, the state health department isn't recommending any quarantine post-domestic travel. As we all know, that could change depending upon the situation around the country, and I think following the state guidance would be what's recommended if the state does change that to a quarantine after travel, and likely it'd be identified regions for that quarantine.
Just a quick follow-up. I assume that answer means you do have some restrictions for international travel?
I believe at this time there are some recommendations for international travel, a 14-day quarantine afterwards.
If we're even able to get out of the country to travel internationally. Since you're up here, Sean, I have a couple questions for you. These are questions that have been asked by others and at previous meetings. As I see our new activities matrix, which we aren't there yet, but has levels along with our restart plan related to community spread, do we have the data, or is it currently published anywhere, the active number of cases that we have in Grand Forks County that are a result of community spread?
The data, as it corresponds to community spread specifically, isn't publicly available but can be provided upon request. I would caution tying any specific opening, closures, precautions to a single metric. I think it would be very good to consider kind of many variables in those decisions, and to not tie yourself to any specific threshold or trigger point, to allow you flexibility to respond, because there may be situations or things that we can't foresee.
So as a follow-up to that, our current matrices are specific to the level of community spread. So how would you give us guidance in how we can best develop those matrices? I mean, should it be the level of active cases per 100,000 just in general, or in total, or how should we go about doing that?
Myself and Grand Forks Public Health have been reviewing other school plans, and I think Fargo-Cass Public Schools has released their plan, and I was pretty impressed with what they had put together, and would suggest reviewing some of the criteria that they have in regard to their decision process for deciding what level of instruction they're at, and precautions. They have many variables that are going into that. One of those is community spread. Others are local hospitalization rates, death rates, their substitution capacity, absenteeism information. So it's a more complex approach, and they aren't identifying any specific triggers that would box them into making a decision based upon, community spread cases. The other limitation in marking off your community spread cases is we don't have a period of time that we're evaluating this. And so my recommendation would be to consider the decision process at 2-week intervals, to decide what you may want to do depending on the changing circumstances over 2-week intervals.
Is that part of the reason why the data isn't publicly available? Because it changes every day? You're assuming that if there's, let's say, X number of active cases of community spread, there's likely also more. Is that why it's not publicly out there?
I think it's not publicly out there because the metric isn't entirely useful individually to be making these decisions. Community spread can capture a wide number of situations that may not necessarily line up with an accurate measure of what we would determine to be risk, community risk. It doesn't necessarily directly correlate to community risk of exposure.
So are there, besides Fargo's plan, are there other considerations for an active community risk of exposure that we should be considering?
I believe Fargo's plan was a very good assessment of the considerations that a school district could take into account when making these decisions.
Okay, thank you. Bill?
I just looked at a map before I came on the North Dakota website that had active cases. And you can click on counties, and Grand Forks was at 60 active cases. And yesterday it was at 57. So I don't have a life, so you see I follow that, you know. But is that up to date, gets date, or up to date, or updated every day?
Yeah, active cases, that is updated every day. What's not there is how many of those active cases are attributed to community spread, household contact, close contact, or other exposure types. And so that's not what is publicly out there, and that can change at times depending upon you know, whether a type of spread is under investigation, or in the future it's determined that someone had an exposure in a close contact and that community spread could be changed to close contact. So it's not a, you know, it's not a static point with community spread.
Okay. Now that active case that's there in the senior living units, if they have a case, a person has to get 2 negatives before they can go back into their living quarters. If there ends up with 2 or 3 positive cases in a row, are they considered 1 active case, or is that 2? If they were tested on Monday and then tested again on Thursday and they both were positive, is that considered 2 active, or?
Actually, at this time, it isn't recommended for anyone to discontinue isolation based upon negative tests, regardless of their setting. But if someone is serially tested and it's within 90 days and they continue to be asymptomatic, that subsequent positive result is considered part of the same case.
Okay, thank you.
I have a, no?
Just a clarification on the classroom school matrix. It's, you know, we have levels no spread 5 or less per 100,000, moderate 6 to 10, and then substantial is greater than 100. Should that be greater than 10? Or that is, so then we go from 5 to 10 to 100.
Catherine?
Mr. Delta, I can respond to that. So what we intend to do is, so that original model was adapted from models that we had seen from other districts in all transparency. And we did pass it by public health, and they felt like it was a solid guideline again. But what we intend to do is to really update the language in there, and what we now have moved to as far as the language is regarding our spectator is different. And there we're not talking about active cases as much as it is transparent here. So Gina Wheeler actually reached out to the Department of Health to give us our, I don't want to use the word cut points, but our guidelines to try to marry the language so that we're all on the same page there. So that we anticipate there'll be modifications to that document accordingly, and it'll be more clear then to our public and to ourselves.
Thank you. And just to confirm, right now, my understanding is that we're at Grand Forks County is at 957 per 100,000. Is that correct?
I don't have the exact data points off the top of my head. I'd have to check.
Okay, that's the data that Mr. Palmasino was addressing. Our numbers are at that point.
I would
now.
defer you to the website. Yeah, it's
okay.
our accurate count as of today.
Thank you, sir.
I think I had asked that question last week too, Chris, and that definitely wasn't community spread only, but it was active cases per 100,000.
After asking that and her
positive.
commenting it, I recalled.
Moving a little past just the COVID period, I know pretty shortly here, we're going to be entering flu season. I know Grand Forks Public Schools had, I believe it's called WellCore, come in and deliver flu shots to our students. Does public health anticipate that being impacted somehow, or is there a plan to deliver flu shots still at the school level?
I'll defer that question to Grand Forks Public Health, who does the immunizations.
Thank you.
Hello, we're tag teaming again. Thank you for the question. We have talked to WellCore again this fall about coming in and distributing vaccine in the fall, and there are ways to do that safely. I'm not sure exactly what your question is. We don't plan to change the model. We don't plan on going in ourselves from Grand Forks Public Health. we're still assuming that Wellcore will do it.
Yeah, I was just wanted to make sure that if Wellcar said we're not doing that in light of COVID, or if we're still available to come in and deliver flu shots, and if that might change depending on, at that point, let's say if we're at all virtual, or, you know, can they do parking lot flu shots? I don't know.
I can tell you that Grand Forks is looking at different models of distribution for the community that would be including drive-by or drive-through models, so that people are separated. You have staggering of cohorts, so you don't have a lot of people waiting in the waiting room, that sort of thing, if you're doing appointments. There are different models that you can work through, and I think that Wellcore does have a close relationship with the health department, and we have been talking to Molly about different ways to do that. So I think that there would be a way to get a plan together to not have congregate distribution, not have those kinds of elements that would expose people. But I do want to emphasize that immunizations, not only influenza, but all immunizations are going to be vital as we go into the season to, one, reduce diseases, but also to not have that confusion. Is it influenza or is it COVID? It's going to be less likely if you've been immunized. So.
I just want to point out, last flu season in the United States, 170 children, I think, died in the United States. Last time I looked, there were 80 pediatric deaths from COVID. So over double died from influenza compared to COVID. So this is a critical thing. And I know, well, Jody has worked closely with Wellcore. It isn't going to be just Wellcore. It's going to be all the health systems are going to have to really get together, and that may include Alaris Center vaccinations and stuff, because right now public health is tied up 150% with COVID, so they can't help us right now. It's other people are going to have to pick up the slack.
I'll just confirm that we do plan on holding school vaccinations again with Wellcore. We have a meeting come up in the next couple of weeks, and I know Molly has been in communication with public health about any additional procedural safeguards that we have to have in place. But to everyone's point, we have such a high immunization rate because we offer that in the school setting. If we didn't do that, I'm afraid that rate would plummet. So we still plan on holding school immunization clinics.
Since we have public health up here, are there any more specific questions related to public health? Go ahead.
Sean, we talked a little bit last week about trying to get regional or county-specific data, and tonight you mentioned a lot of good things about looking at death rates, hospitalization rates. Are we going to get to the point where the state is going to give us county-specific data on a weekly basis with 5 or 6 things that are easy for people to look at?
That is the goal, and the health analytics team at the state is looking at generating reports for different purposes, for universities, for schools, for local public health, and it may come through local public health or it may come directly from the state, but that data is planned to be provided, especially if we have some metrics that whatever group is interested in looking at.
And I don't like hearing that, well, that's not available to the public. I think all this data should be available to the public. You may have to explain some of it too, as well. You always get the really hard questions, so I'm going to ask you one easy question. What's 4 plus 4? So,
I'll defer to my calculator.
so then you can go back and say, well, they weren't all hard questions. I had one easy one.
I do want to say that I do agree that the data it should be public, and it is public upon request. It's just not all published on the website. So I'm certainly happy to fulfill data requests or send them to those who can fulfill that data request.
Thank you.
Other questions for public health colleagues? Go ahead, Jackie.
This isn't actually for public health, so if someone had some.
Yeah, since Sean's up here, if we have any specific public health questions, and we might have more as it relates to, but okay, thank you. Jackie.
So last time I had mentioned just the importance of, since we are doing day 1, day 2 kind of activities at our high school level specifically. I had talked about how, so if I develop symptoms today, I'm actually symptomatic 2 days before. And so it doesn't really cut down on the number of contacts. And since we were sticking with that, I had mentioned the idea of really driving home that idea with teachers that, you know, we're going to have to teach a little differently than maybe we have learned for best practice, right? We know best practice is splitting into groups, pairing up, doing alternative kind of learning styles, and some of that may not be as possible now with, because you'd increase your number of close contacts that way. And, you know, after making that comment, I got some emails saying, include middle school in that. So I felt like I would only do my due diligence if I said, I also am including middle school because they have a similar format. And so I just wanted to say that and encourage people at home, you know, if you have other questions about those types of things, to obviously contact administration about that.
Okay, Cynthia?
So my questions are all about virtual learning. Do we want to move to that kind of setting?
Sure.
Okay. So to kind of dovetail on Jackie's question, I do have a series of questions here too. But the day one, day two, is it possible, do you think, for elementary to spell out what a typical day could look like? I know we've got that 20% in there, but is there a way to kind of help parents understand what their child's day will look like at the elementary level, at the middle school level? I know I'm asking a lot, but these are the kinds of questions that I'm getting. And so I'll have you
So I
give
can tell
a
you,
try at that
we've
one.
developed a template, basically the same template we used last year, where we're really focusing on the core content areas: language arts, science, social studies, and mathematics. So the day will include blocks on those core content areas. For science and social studies, it might be a alternating day, so students wouldn't get science and social studies on the same day, but they'd get it alternating days. And then obviously there is time built in there for the teachers to do small group work or contact individual students. We'll probably have some time in there for our specialists to work with our elementary students, whether that's, I guess we haven't decided on music and PE and Spanish and all of those yet, but we'll figure that out after we get our survey results back from those that are going to choose distance learning and which staff members want to participate as a distance learning educator. So really it's a full day, Cynthia, but students aren't going to be tied to their computer because some of that will be in-person learning and some of it will be recorded lessons. So it's very similar to the template we used last spring when we changed from in-person to distance learning. And we can certainly send that out once we have not finalized what the exact schedule will look like. I think we want to meet with our distance learning staff members that are going to be providing that and provide some guidance from there. But we will certainly communicate what the schedule, what the final schedule will look like with families before we start distance learning on late August.
So that's great for elementary. Keep in mind that I raised this last time. So there are families that have told me that their children had no classroom experience, that everything was just worksheets given to them. So I think across the district now we're trying to get that 20% so that it's a little bit more uniform from teacher to teacher. So I think that this idea of giving parents kind of an idea of what that day will be like would be very reassuring. So I appreciate that you're working on that.
And if I would just mention that our CIT department is providing all kinds of resources, not only for our regular classroom teachers, but those teachers that are going to be distance learning teachers will also get a lot of professional development on how to make those lessons meaningful to our students and how to make those connections, and that will be a big focus. We did that on the fly last spring. We've got plenty of time to get ready for that this time around.
So then what about middle school and high school?
Yep, so as the document says, it's a little bit different at the secondary level. That's why the word virtual academy versus virtual classroom was used. The way that will manifest itself is that there will be a licensed teacher who is assigned to a cohort of kids that will become their cohort or their classroom. You can use those words interchangeably in this sense. The actual content classes will be under the guise of that Edmentum platform that you mentioned before. Edmentum is an online platform, and the curriculum is all built in alignment with our standards. It has project-based application work as part of it. It has tutorials built into it. And so a single licensed teacher who might be licensed in mathematics would be overseeing the pacing, the helping students problem solve when they get stuck, et cetera, in all the different core content areas. But the curriculum itself is developed by Edmentum. So as opposed to the elementary teachers who are going to be creating all of the curriculum, they're just going to be facilitating the curriculum and helping coach kids through that and problem solve. If they get stuck on a concept or a skill or a unit or what have you that is outside of the realm of what that coach teacher can help the student with, they will then rely on their content expert colleagues to help jump in and coach a student through that unit or that skill or that concept. Are you following me so far?
I am really trying to follow you.
Okay.
So this
but
Edmentum.
if I'm not finished yet. Sorry. So the other component to that is that the teacher, and we haven't met with them yet, as Mr. Thompson said, but when we find out who those teachers are, we have during professional development a workshop time built in where we'll talk to them about their expectations, but we fully expect them to bring their cohort together synchronous times throughout the course of the week so that they can build that relationship, so they can build relationships within that learning community, that they could potentially pair up kids who have similar or identical courses to have partner work occur even when the whole group isn't together. Kind of like, I'll use my kids for an example. When they go home and do their homework, if they get stuck, they have their buddies that they either go to their house or call to try to problem solve. So the teachers will be able to orchestrate those sorts of groupings through the online platform so that we are building relationship and building community that way, that they're meeting with them at synchronous times to just talk about problem solving strategies, et cetera, et cetera. So there will be times that they're coming together for that 20% mark as a full group, but considering different kids may have different schedules, it won't look the same as the elementary. They probably won't be coming together to be taught the Pythagorean theorem. Does that make any sense? So then the asynchronous part comes when students will be completing their coursework, and the coach will work with the students and their families to devise the rest of their schedule. So there's more flexibility built in for that asynchronous time. So when are you going to complete your mathematics? When are you going to complete your social studies, et cetera, et cetera? Those individual schedules, as far as how the day parses out when they can do the asynchronous modules, will be individualized for each student because they might manifest themselves differently because of what's going on at home or other responsibilities and that sort of thing.
Just in the spring, my grandchildren were in elementary and middle school, and every Sunday, their parents were emailed the schedule for the week, so they knew. I don't know about high school, but I know about the other. They had their schedule for the week, so they kind of knew what they were studying for the week. Is that going to continue this year at the elementary and middle school? So they will know on Sunday, well, here's my assignments for the week.
Yes, that will continue.
So maybe I need to do some work on my own about what this Edmonton teacher, I don't want to get too nitty-gritty here at the meeting, but I think I need to be able to explain it, and right now I couldn't explain it to somebody. I don't quite understand if they have a Grand Forks Public School teacher who helps them like their homeroom, so to speak, and then they get an Edmonton teacher for math, no.
Yeah, the Edmentum platform is just the curriculum and the delivery. There's not a teacher on the other end of that unless we hire that teacher, right? So we could have the option to hire Edmentum staff. That's not the case. So I apologize if that was how it came across. It's really just a packaged curriculum that has modules already pre-made, that has follows the scope and sequence of our North Dakota state standards, that has assessments built in. So the coach teacher isn't trying to create all of the curriculum and the assessments and the modules for math and science and social studies, et cetera, because they're only licensed, highly qualified under one area. So they're more of a mentor and a coach, and then the courses themselves are already pre-built by the Edmentum company. Does that help clarify a little bit?
That helps me a lot, thank you. Is there an additional, so I looked at the budget, trying to find the cost of this package. I guess we've been paying for that all along.
Yes, we've used Edmentum courseware for 3 years now, I believe, to various degrees. And so we already have been in contract with them. I anticipate that we will have to increase the number of licenses that are probably beyond the point that we typically have used them. But right now, it's not built into the budget because it's been part of our budget. There are additional, and we were leery to just say Edmentum because we thought it would be more confusing, and maybe we should have because it would have been less confusing in the end. But there are some courses that we may have to tap into from the North Dakota Center for Distance Education as well, if Edmentum does not offer them. So some of our specified Grand Forks Public Schools CTE courses, for example, aren't necessarily all represented in the Edmentum course catalog. So we will use more than one prepackaged online curriculum if we need to try to meet students' needs.
Mr. Thompson?
I was just going to encourage board members, refer questions like that to us, because quite honestly, we answered a lot of questions this weekend on our own personal time, and we don't mind that. We'd much rather, with all the details and all of these plans and all the frequently asked questions, we don't expect you to know every detail of this plan. So we would actually prefer that you send those parents to us, and then we can provide accurate information to them.
I've heard that before, thank you. I think part of it is that parents who reached out to me felt that they'd already gotten an answer but didn't still understand it. So I did send these questions to you early in the day too. The other question that I have about the virtual piece is related to if you choose virtual, and we go through November, and COVID is miraculously gone, which let's hope that's true, but I don't think that's going to happen. Can they go back to their school, their neighborhood school or home school or whatever school they were at? So even if you're a high school student, can you go back to Red River? Can you go back to Valley? Can you go back to the school that you were going to go to if you were physically going to school?
So those are some of the questions that we answered this weekend, actually, and the answer is we'll make every opportunity to get those students back to their regular neighborhood school, but we are staffing according to what parents are selecting, whether that's in-person or distance learning, and so we can't guarantee it, but we'll make every effort to get those students back into their regular neighborhood school.
Could I? No. If I could just add to that, just for even more clarity, on the survey for parents, we've asked them to commit. So Cynthia, to your point about November, if it's an elementary school age child, we've asked them to commit to that first trimester, either at home or in school. So they can choose to adjust after that. It's kind of that time leading up to it that we want people to kind of get anchored in, because we're going to have to, as Mr. Thompson said, link staff to students in a virtual world and also know what our numbers are at the building level. But we also will work with extenuating circumstances if families have some compelling reason to change. We will work with them.
So I have a question about, and I'm assuming this is probably something that's going to happen, but let's say we have a distance cohort of elementary students, and we have, 2 or 3 teachers that are working distance. There might be some families that have a kindergartner and then have a 3rd grader. I would assume that maybe those teachers would be coordinating, so they're not doing face-to-face time at the same time as other siblings, or trying to coordinate those schedules to make it a little easier on parents. I guess what I'm asking is there going to be some distance level kind of collaboration kind of happening that's going to be separate from?
I think Jackie will make every effort to make that happen. Obviously, families that have lots of students, that's going to create some challenging issues for us, but it's something we can try to work towards for sure.
Even if it's just a matter of just, as a teacher, and I'm assuming it might even happen naturally, is just what's working for you, what's not working for you kind of pieces. But I know some people are kind of concerned about that. I did have another question that maybe is overall administration. Are we going to be putting out any kind of plan that allows people to know what the steps are if we have to pull back from face-to-face learning? So, you know, any kind of guidelines in terms of maybe if you have this is going to be the process, this is how you'll get notified, this is how long it'll take to adjust, or any kind of thing that could help people feel a little bit more secure in how those transitions will happen?
Well, if you're talking about what we do at a classroom level or a school level or a district level, you know, once this is cleaned up a little bit more, we'll communicate this document to parents too.
I think just to benchmark off of Jackie's question, I think more so just is there going to be any sort of contingency plans produced in this document as a draft to just say, if we have to pull back from face-to-face, what will that look like for individuals? Or if we do have to quarantine for a said number of time, will that schedule mirror what happened in the classroom on a daily basis? You know, will the teacher know their expectations of being prepared to have lessons online? Maybe does that help broaden kind of what you're looking for?
Yeah, we did provide just a link to the information that we'll be reviewing with our teachers as far as the expectations go, and similar to what Mr. Thompson mentioned earlier, the routine that would occur at home would be very similar to what we went to last year, but better because we can actually prepare for it. But maybe we need to make that a separate document and not a link within the document itself, is what I'm hearing you say. I mean, it is a separate document. Maybe we need to advertise it in and of itself, perhaps. We could probably put that out there in our website. Tracy Jens is developing a kind of a catch-all website for everything that we've discussed over the past several weeks here, so that anybody could go and access that at a heartbeat. So we'll make sure that we parse that out.
I actually do like the links. I think they're very helpful and they're within the document, but I think there may be some other folks, and I've heard from some people that they missed that link. So maybe they didn't click on it or know it was a clickable document. And so whether that's we find a section for some of those plans, or maybe they're, appendix items or whatnot, I think that could be helpful. Just presenting it in a different way for each reader, I guess.
I think Shannon coined the term flexible this year, or maybe Dr. Brennan, somebody did. And I think we just have to make sure parents understand that they might have to be flexible, because in the life of the COVID pandemic, we may go from a full classroom to an empty classroom and have to go virtual very quickly. And I don't know if you guys have any time frames, if that's a 2-day turnaround or 3-day turnaround or what. You know, in the spring, we had a little time to prepare. We shut the schools down, then we had a little time to prepare, but we're going to want to be nimble this time, because you don't want students not learning at all for 2 weeks. But I think, and I'm assuming a lot of parents already know this, it's going to be flexible and it's going to be a little chaotic. I mean, I don't know what percent of both parents work in Grand Forks County, but I think it's 60-70%. So they may have their kids in class on Thursday, and the following Monday they may have to go virtual. So I think we just have to make sure everybody is prepared for that, and also understand there's going to be unique circumstances, and I'm sure you guys are more aware of it than the rest of us.
Yep, just to speak to that, Dr. Lund, we've kind of used that 72-hour guideline as far as when we would expect classrooms to come online, with the asterisk that some may be able to go online even sooner, but that 72 hours is kind of when we're, again, monitoring additional cases and seeing if it's going to be more long-term and that sort of thing.
I just wanted to point out in the July 28th meeting that we had asked to consider oral communication of the final plan, which I know there is no final plan for New Americans, and I'd encourage us to continue to look at those avenues because there's a lot of confusion.
And Cynthia, I wonder if maybe your organization and other organizations could help the school district with that. Or I know a lot of times when I'm seeing, because I see a lot of new Americans, a lot of times friends or other family come in and it's kind of a communal effort as far as education. And I don't know if there's something, Global Friends, or there's other organizations in town that could try and help us spread that word beyond just school district employees.
Yeah, thanks for that. So I got a Facebook message or Facebook post, and Global Friends is already listed as convening a group along with the district and another group in East Grand Forks for Grand Forks. And I was like, oh my goodness, it's, so I feel there's a lot of pressure. I will say there are so many families that take advantage of Century Elementary School, and Global Friends has gone there and just done pop-up conversations that have been really great. 7 to 9 to 12 parents come. So I think that would be a great location, but then the school is bigger and could house a socially distanced event. And I think we would greatly ease parents' minds if they had an opportunity to hear it. I tell you, I've been handed a phone so many times the past 5 days and look at all these text messages from the Grand Forks Public School and can't begin myself to explain it all, because the language is overwhelming. And so I think it would just behoove us to reach out to that fairly significant population. So thank you, Dr. Lynn.
I have a few, go ahead, Chris.
I know it's a piece that I have discussed, and I know the district has been very diligent, is the emotional needs for the students in the district. And I would say particularly those students who may be doing distance learning where there's not a visual, there's not communication. So teachers and parents will probably be doing some visuals and obtaining information. I also recognize that you had professional development for all administrators, I believe, in this avenue recently as you prepare to bring the teachers back. And as the school year starts, I know the SROs had some limited capabilities because of assuring that the city was protected, but their role will probably return to pretty much normal. And I know the counselors and the county services are prepared to assist in those areas. I don't know if the right word would be more so, but perhaps with more abilities, knowing what they now know compared to what they knew in March or April. Would that be correct?
Yes.
I have a few questions that are kind of just random questions. I had this asked of me, will there be air purifiers for classrooms provided or reimbursed if buildings do not have windows that open or fresh air circulation?
I'll take the first swing at that. Chris Arnold and his department are looking at some different appliances to help with air quality. It's likely that we would not be able to get one for every classroom, but certainly looking at some of the classrooms that have more issues than others. I'll give you an example. We had our facilities task force tour Valley Middle School and West Elementary School last Thursday evening, and it was between 6 and 9 o'clock at night. And in the upper A wing at Valley Middle School, it'd be the second floor, 7th grade wing, while it was 72, 73 degrees outside, it was 94, 96 degrees inside. So the task force who moved through that recognized immediately that kids can't learn in this kind of environment, and that's really, our classroom conditions, oftentimes the first 2 to 3 weeks of school. So that's my long way of saying Chris is exploring that. Anything that we do purchase that would be related to air quality and the condition that we're in, Scott is coding as COVID. And Scott, I don't know if you had any more information to add to that based on your close relationship with Chris or not.
Chris and I have had some conversations, and he's looking at a couple of different vendors. I don't recall a number off the top of my head. It's pretty significant. District-wide, we have over 1,000 classrooms, so it's certainly. And some of our facilities, do have air conditioning and greater air exchange, but we wouldn't be able to provide one for every room, I don't believe. Certainly within the time period leading up to school, from a feasibility aspect or a financial aspect. But we are exploring. There are areas that have been prioritized for that, as Dr. Brenner mentioned.
My next question is in relation to specials teacher. I think I'm using the right term, but I would say like a CTE, music, gym, PE. If we had a teacher who chose to teach online, who's in kind of one of those fields specifically, I guess my question is, are they protected? A lot of what they're doing is a lot of that one-on-one, in-person education, and I would think that it would be more difficult for those types of teachers to teach virtually. Now, they can certainly do it, and they obviously had to figure out a way in the spring. But I just wonder if there's maybe that group of teachers that feels hesitant to, maybe they want to choose virtual, but they feel hesitant to do so because they wonder if that's going to be supported or if that will work, in terms of how they teach virtually. So I guess I don't really know. So more of just of how those types of teachers would facilitate a classroom discussion virtually. But I also want to make sure that, those teachers feel protected and safe to say, I don't necessarily feel comfortable coming back, but I would love to deliver a curriculum online.
I'm sorry, I still have my microphone on. Just looking at the preliminary numbers, even though the survey for parents closes tonight, I'd say the average per grade level across the spectrum is just a ballpark, so please don't quote me on this, but I'm going to say it's about 75 students to 80 students per grade level who want to stay home. So given that metric, we know we're going to need music teachers online, PE teachers online, specialists online. So, and just Madam President, listening to you use the word protected, they're protected by the negotiated agreement, and they're protected by the culture of our district. So we want people to tell us if they have a underlying medical reason to teach remotely. We want to know that, and we would love to have a medical certificate indicating so. We probably won't be a large population of teachers, but we're also going to have to lean on some other teachers who didn't sign up for remote learning, but who have actually said, I'm willing to help when and wherever.
Thank you for that. I agree that I think there's been a culture that's been created that allows that the ability to communicate in a better way. I hope that people feel comfortable, at least coming forward and saying what their preference would be. We've talked about kind of virtual teachers, but I guess I don't know that we've really discussed where these teachers will be placed. So is there going to be, or has there been conversation about utilizing a specific building for these teachers to do virtual learning? Are they expected to do it at their own home? Is there places at MSEC that they would offer this? I'm just curious where the placement of virtual teachers will be at. And then as a caveat to that, teachers who are in the classroom, if we did go virtual learning, will they have access to the buildings, or has that been talked about? Socially distanced, wearing masks, but maybe have access to a building to continue to teach if they have to go online.
So I can take a crack at the first question, Amber. I think the expectation when teachers signed up to be distance learning teachers, their expectation was it would be done from their home. We can certainly provide additional resources if those distance learning teachers need that, but I think the expectation was they would teach from home. Their classroom back in their school may be used for something else. It could be to space out more students, or it could be for another purpose. So I think the expectation when teachers signed on to be distance education teachers, it was that they would be teaching from their home. The second part is if we do have to pivot and go distance learning at a school setting or across the district, once our facilities are cleaned and sanitized and safe, we would allow teachers to go back in and teach from their classrooms if that's their preference. Some may still want to teach from their home, which is fine.
Just a comment following up on kind of Cynthia's topic, I would encourage the district to reach out to UND students who might be bilingual or have resources. Oftentimes we have graduate students in health studies, public health, going for their doctorates, all sorts of things that you think are being utilized, but sometimes they haven't been asked. So I would encourage maybe some resources there. My other kind of question / comment, I know I brought it up very early, but the idea of mental health, I think we have a really good opportunity here because COVID, it tends to create its own anxieties, special strains on students. And certainly that's different if it's a distance student versus a student that's in person. Distance students are going to be dealing with isolation and dealing with not being around friends and socializing. And your students might be dealing with a little bit more anxiety regarding germs and if I'm doing the right thing and if, all of those pieces. And so I know we have a lot to cover and we haven't covered every kind of area yet, so I'm not trying to put the pressure on, but just kind of as a reminder, maybe our mental health coordinator, if we've set up anything that could be tiered throughout the grades to kind of discuss those items and get ahead of some of the mental health issues that might happen or kind of have those open discussions so we can flag students who might be struggling a little bit more with certain topics. And then also, if we could have some sort of presentation maybe after the first quarter of things starting, just to see how our students are dealing with these changes.
Yeah, just so you're aware, I think Mr. Douthit alluded to this. We did actually kick off that conversation with our administrators on August 4th. We spent a full day talking about trauma-informed practices, how SEL ties into supporting students who might be coming in with either trauma backgrounds or just general stress that might not qualify as one of the ACEs, if you will, if you're familiar with that terminology. And so we are definitely trying to stay ahead of that work. There is a really comprehensive and well synthesized document that Mr. Gockler put together that links classrooms, whether they're virtual or face-to-face classrooms, all kinds of lessons and protocols and procedures to help build that safety, help that connection, have the conversations that you're kind of alluding to. And then as far as if we see mental health concerns arise, the whole team is prepared to respond as they were even as soon as last March, whether it be virtually or online. So that is definitely at the front of what we are wanting to make sure that we're attuned to when we re-enter school, versus be it face-to-face or distance-wise.
I think most of my anxiety patients are signed up for virtual because they're all afraid of COVID. So I think just having that option has lessened their anxiety. I actually had a mental health question too, but I'm wondering about staff. I mean, we know depression, everything has gone up with this pandemic, spousal abuse, child abuse, suicide. Are there specific things we're doing to support our staff when it comes to mental health and just the stress of the work environment and in the pandemic?
Better. Okay. Good evening. How are you? Yes, we do have an employee assistance program that we would utilize, and we're sharing that information to our staff, as well as working with Mr. Gockler too on some initiatives that can be both partnered with our students and our staff. So yes, we keep bringing those things to light, and we'll keep bringing those things to light as we move through this fall.
And I'm even thinking simple things like little one-page placards about here's the 6 things you can do to help reduce your stress or your anxiety. I mean, little things about your meditation, make sure you exercise, sleep, just simple things that you can just hand out to staff as well.
Thank you. Those are great ideas, and absolutely.
Since we have Ms. Root up here from HR, are there any questions related to human resource specific topics that anyone has? I did have one. I caught a video that was published from North Dakota United where their attorney has been answering just random questions that they've been getting from teachers. And one question I've had that he answered was about the negotiated agreements. And he did say that each negotiated agreement by each district should be followed. And, there's necessarily not any additions besides federal or state programs or executive orders that come out, which allows more funding for things. And you alluded to sort of a payment for WSI, essential workers and teachers weren't included in that at this time. But I'm curious about, and I'm not suggesting again that we change our negotiated agreement or anything like that, but I am curious about, there's going to be those extenuating circumstances, and while I believe our sick leave and benefits, especially for a teacher after 6 years, is broad with the 65 days, a lot of those teachers underneath that might not have enough days for coverage. So you start to consider, well, let's say a teacher got sick and they have to be quarantined for 7 to 14 days, and then maybe a month later their kid gets sick, and so now they're back at home or what have you. Has the district talked about, or would there be any conversation that could relate to specifically this year, maybe exploring a donated leave pool? Again, I'm probably opening a box here of a negotiated tool, but I think there's little waiver. He didn't really address, the attorney didn't really address any additions per se. But I'm just curious your thoughts, or if there's been talk about that, whatnot.
No, Madam Chairman, great question. I think that's worth further discussion. I think to echo Dr. Brenner, we've created a culture of working with our employees, working with our staff, and number one priority in a situation like that is how can we adapt, how can we be nimble to find alternatives for that staff member to keep working. Is there a telework option? Is there an alternative working option for them if they are staying home and they're not ill? So that's number one, first and foremost, because we want to make sure that we're exhausting those efforts, keeping our operations running. We're not overstaffed by any such means, so there's always work to be done. So I think that would be number one, and then it keeps their leave balances full. So that's our main priority with those types of situations. And then in the event that we get in a situation where they do have to use their personal leave, they still have that emergency leave that they can use that's backed by the federal government, that 10-day leave one time, which is expires December 31st, but then more to come, right? So, yes.
And if I could just add, the other thing that we've talked about is, we have all these different leave banks. We have personal leave, we have family illness leave, we have bereavement, personal illness. We've talked about allowing staff to pool that leave. So if they run out of one category, that's not going to be a problem. Probably bereavement would be the only thing we want to keep separate. But it ties kind of right into, I'm looking at Melissa, it ties nicely into the teacher leave benefits study that we're going to be pulling that committee back together here within the next 5 weeks. But we want to adapt and be somewhat flexible, with that. Does that go against the negotiated agreement? Perhaps it does, but we want it to benefit our colleagues, not punish them.
Thank you. Other questions? Go ahead.
I don't know if it's for you, maybe Dr. Brenner. At the very beginning of the meeting, you talked about paraprofessionals in COVID rooms. That was, I think those were your words. Are those new paraprofessionals or reassigned paraprofessionals? And I'm sure there are some risks with that as well.
Yeah, these would be what we would call, I would call a quarantine room. If a student comes down to the office with symptoms, we want to make sure we have somebody there who can manage that situation. That's not, because our nurses aren't full-time every day at a single campus because they move a lot. So we want to make sure we have somebody at every campus who's available to do that kind of work. And then we know that we're not going to have students coming down to the office constantly, so we want to make sure we've got some other roles and responsibilities for those staff members. Are they new? Yes. Have we posted them? No. this is the first time we're really talking about it publicly. We haven't talked about it with our principals yet. We haven't talked about it with our teachers yet. So you're getting a little bird's eye view on what we intend to do to really make things happen seamlessly. Because that needs to be, if somebody's exhibiting symptoms, and this is probably more for Dr. Lund than for Terry Brenner, we want to make sure they're isolated in a room and away from everybody else.
And please don't call them COVID rooms, because odds are they aren't COVID patients. They probably have the flu or a cold or something else.
A quarantine.
Other questions for Ms. Rood as she's up here? Okay, thank you. Other questions about the Smart Restart Plan that maybe haven't been answered yet? Go ahead.
Just a comment, I think we all recognize in Georgia, a school reopened, and there were probably pieces that may have been allowed or not followed, and 30 students in that school ended up with the virus. If you looked at the picture that the one student took, it was very evident and very obvious. There were no precautions in place by the students in the hallway. So again, when we look at this plan, it's diligent, it's well thought through, working collaboratively with others in the community across the state, and yet Dr. Brenner and the leadership recognizes that could shift on a moment's notice based on a situation or an incident. So again, if everybody does their due diligence in the schools, prepares as best as possible, and hopefully people are safe outside of the school. And I notice the city is now encouraging masks as people go into businesses. It's not a mandate, but it's a very strong request, a polite request. Hopefully, we as a community will be able to open these schools as safely as possible, as long as everybody does their part to assure that we do it right. Because if we don't do it right, we've seen what can happen in multiple locations, and I certainly wouldn't want to see that here, and I would say the leadership is doing everything they can to assure that that does not happen here.
Just to tie into that, if Eric Lund wants to eliminate the risk for me getting COVID, I need to go to Hugo's after this meeting, collect about 6 months of groceries, go to my home, padlock the door, lock it, and stay there. That would eliminate my chance of getting COVID. We're not talking about eliminating, we're talking about mitigating risk, how to make it the safest possible way. It's all about mitigating risk, and no matter what we're talking about, whether it's schools or going to Hugo's or it's talking about mitigating risk. So I think, I've talked to some people recently, and they think, well, you're eliminating the risk. Well, no, we're not totally eliminating it. We're mitigating it as much as we can.
My question is more of maybe a budget staffing. I know we have someone who is working on behalf of the district for grant writing. Is there any way that person or other people on staff are looking into federal funding and our options there? One of the things I particularly think about is when you mention nurses. I really think we need nurses during this time, and I think nurses should be fully funded, and I think that we should be getting that money from somewhere. So just kind of a question about who's looking out for that funding, and how we spend some of that funding, and if there's any options for nurses in particular, I guess is what I was thinking about, but I'm sure there's tons of other things people need to.
So Tanya Schleicher is our grant writer, and she's well aware of the district needs for COVID-19 related expenses, whether that's supplies, equipment, or personnel. I will tell you there's federal funding that's tied up in Congress right now that if they would release that would flow to the state and then ultimately to the school district. So we're hopeful that a lot of these expenses that we're incurring on the front end, and potentially more staffing, I would agree with the nurses, but we can't afford that right now. But if there is additional funding that comes down, we could certainly look at increasing some of those staffing areas, especially specialized areas like nurses. But we're aware, and Tanya's tracking any additional grants that might be out there outside of the federal government programs.
I am so thankful we approved that position.
We've also, just as of today, reached out to the UND School of Nursing to see if there's some possibility in partnering with nursing students. So that's probably a little premature, but just want you to know that we're exploring that.
I love that we have that connection to do so. I mean, lots of opportunities there. I know that we've referenced an FAQ document and then some supporting documents that go along with it. Do we have a timeline of when those might be released? I know there's a ton of questions that have been coming in, and the district has been doing such a great job of answering those questions and then kind of documenting and putting them into a big document. But for those who are maybe still waiting on making decisions or are waiting for their phone call because they didn't select an option, do we have an identified timeline for that document?
It could be as early as this evening. It could be tomorrow. Yeah, we're still working through some of those questions. Tracy Gents has really taken on that heavy lift independently, but there have been a few other people who have been weighing in on some of the responses, Lindsay, Jody, Catherine as well. It's just taking a little bit longer than anticipated.
Well, I certainly know that there's probably, just by the amount that I've gotten alone and other board members, I think just knowing that volume is probably overwhelming. So thank you for pulling that together. Dr. Brenner, you mentioned Ms. Gents and kind of working behind the scenes in terms of a communication aspect. Is the district prepared, or have we had conversations about, you know, for instance, UND has a COVID-19 blog, and every day they update on a section of their blog. It says UND has had 50 cases since March of X date. We currently have this number of cases as of 8 a.m. today. Is there something that the district is prepared to update or provide on a daily basis as it results to number of active cases within staff or students in our district?
We don't have a link established for a communication tool like that. What I will say is Gina Wheeler is our COVID point person, so when there is a case discovered in our school district, Gina is the first one contacted, and then we have a team of people who work through that process and decide who needs to know. My caution would be we want to make sure that we're not breaching any HIPAA issues, you know, depending on what campus COVID outbreak might happen at. And then if somebody is easily identifiable, but we can certainly explore that and see what that would look like.
I guess just a follow-up to that, I think I've already been hearing people talk about certain things, and as much as it goes through telephone, if we even have one case that happened in our district, I worry that there may be people who are talking about it and hear it through the grapevine, and then all of a sudden there's one case that's actually 20 cases, but it's not. And so I'm just wondering if it would be more pertinent for the district to drive that number, so to speak, and just say GF Public Schools rather than a specific campus per se. But I was just thinking from that perspective alone that we're driving that rather than the public determining through the rumor mill what they may have heard. Other questions on the Smart Restart Plan, Jackie?
Do we have any idea of how many people have responded? Do we have like a percentage of parents? I mean, I'm just kind of curious if we have, 50% of parents that haven't responded, or if it's just 10.
I think as of this afternoon, 80% or higher had responded to the survey.
Can you say that one more time?
Over 80% of our families have responded to the survey versus distance learning versus in-person learning.
80?
80.
Okay. Thank you. Maybe last call for questions on the superintendent's item for discussion, the restart plan. Okay, hearing none, we will move on to superintendent recommendations for action. Consent agenda. Do I have a motion to approve? Dr. Lunn, motion. Doug, second. All those in favor of approving the consent agenda signify by saying aye. Aye. All those opposed, same sign. Motion carries. Item B, school board committee appointments. Dr. Brenner?
Caught me off guard. We shifted so quickly there. Talk about a pivot. Thank you very much for that. So current practice for school board committee assignments is for the board president and superintendent to sit down and collaborate and as a follow-up to the document that Cindy sent out to all of you relative to assignments. Board member President Flynn and I went through the list of who indicated interest in what, and in many cases we had people, we had more people than what we really needed for the committees. So would you like me to go through each of the committees? No. President Flynn? No. Okay. So what you have in front of you would be the list of where all of you landed on committees. I want to thank you for your input, and we would just recommend administratively that you approve the slate of candidates for committee appointments for the Grand Forks Public School District.
And I'll just say that we tried to kind of weight it as an average of 4 committees per person. We know that some may have a heavier lift at certain times, at certain junctions of the year, per se. But thank you for all of those who signed up to be on committees. Do we have a motion to approve the committee appointments?
A motion.
Jackie? Bill, second. Any discussion? Speak now or forever hold your peace if you...
One question is where our school building liaisons, we're not allowed to go to schools, so we're just on call. Is that more or less because visitors aren't allowed?
That would be our preference at this point, Bill.
Thank you.
Maybe we can find some virtual way to connect at this point. All those in favor of approving the school board committee appointment signify by saying aye. All those opposed, same side. Motion carried. Item C, Athletic Smart Reopening Plan. Dr. Brenner, and then I'm assuming you'll pass it on to Mr. Rarick.
So your cover memo talks about the conversation that we had at our last meeting, and you heard an update from Athletic Director Mark Rarick. Included in this packet is an updated version of the athletics reopening guidelines, and just wanted to point out that the one change in the document had to do with middle school athletics, where we are actually allowing some travel to occur within the metro area. So we just had a typo in there for the last document. And there were questions at our last meeting about fan attendance, and we can update you tonight on what that plan would look like based on where we're at in this wonderful color-coded COVID environment. So maybe I'll just pause there, let Mark give you a brief update on where he's at and some conversations that he's been in with ADs from across the state, across the conference in particular. And I'll stop there, and then I'll probably add a little bit more later. Mark, thank you.
Yeah, thank you for having me again tonight. Very briefly, in terms of our work here in Grand Forks, we are 1 week and 1 day into practices now. Soccer got through last week and this morning, and actually through tonight, we started football, golf, tennis, and cross country. So we're up and running. In terms of our work with athletic directors right now, it sounded like today was going to be a fairly big day across the conference. There were a lot of school board meetings that were taking place tonight. It sounded like most of our colleagues, or most of my colleagues in the East, were in some way, shape, or form discussing the fan issue. We have another conference AD meeting scheduled tomorrow morning, and so we'll report out and share and see where we're all at that point. I guess we've had some other small schedule changes in the last week, nothing that was unexpected. The Minnesota news last week caused a couple small ripples, but for the most part, all of our sports have now been reduced to area contests, and most of them in dual form. We have very few invites, very few jamborees. So for the most part, all of our contests will be one of our schools against one other school. So that's what I have. I guess I will answer questions.
Follow up, Dr. Brenner?
I just wanted to add a few more comments before the questions start coming in, because this might help mitigate some of the questions, perhaps not all, but maybe a few. Just wanted to remind everybody that athletics are not compulsory where school attendance is. Athletics are a choice. They're an option for our students. These are not students on a college scholarship. We don't have students traveling on a plane. We don't have students traveling out of state. But more importantly, this is a more controlled environment than what you see at a university level, and I know that's weighing heavily on everybody's mind given what's happening across the NCAA. And from a scientific perspective, we're doing the best we can to advance normalcy within this pandemic framework. There doesn't appear to be a school district in our conference, as Mark just said, at this time who wants to forego fall sports. And our coaches have undergone COVID-19 training, and expectations are very clear for what they can and what they can't do from a practice perspective. And Mark had highlighted and outlined some of those concepts at our last meeting. And further, if there's anybody who is going to provide some oversight relative to what coaches are doing or are not doing, Gina Wheeler is that person. And if people aren't masked up at the appropriate time, Gina's going to let them know they need to mask up at the appropriate time. And I'm not taking anything away from Mark, but Gina has been a wonderful point person with COVID-19 in our school district. And so what's complex is, what you see happening around the world. You see Major League Sports without any fans. You see colleges not advancing fall sports at all. High schools are trying to do things within the pandemic that seems somewhat contrary to what's happening around us. And we realize that, we recognize that, and we're trying to balance all of that within the experience for the student, what our parents of those students expect, and trying to move forward, to Dr. Lund's point, with more of a containment perspective than a spreading perspective. And we're not going to eliminate it, and we're not going to mitigate it through our sports. But these activities that our student athletes are involved in, they're an overall piece of their development, and they're an overall piece of social emotional development as well. So that's why you see it's our administrative recommendation to allow fall sports to continue. And then I'll stop there. So thank you.
Mr. Burke, any additions before we open it up for questions? Okay, any questions for Mr. Burke? Jackie?
What level are we at now? I know that we might be altering this based on what public health has said today, but do we have an idea of where we're at?
Well, if we were allowed to pick our color, we're somewhere between yellow and orange.
And then I had a question regarding, I know we have students do like a concussion slip. There's certain things that we do just to kind of, prevent maybe some responsibility on the district and let parents know things. Have we thought about doing some sort of I know sometimes schools do this for behavior, like I as a student promise to adhere by the code of or by the code of student body life, whatever handbook you have going on, or however you word that. So with athletics, I don't know, are you doing anything like that, where maybe student athletes have to say, I promise that I will social distance, I promise I'll wear my mask in the locker room, those kinds of responsible behaviors, even if it's just something to put a little bit more responsibility on the athlete themselves?
So we have a code of conduct that we use that our athletes need to file every year. They do that at the office along with their pre-participation physical and their fees and all of those things. Within the code of conduct, there is language about representing your team, yourself, your community, your school. The one benefit that we have in athletics in holding people to that is something that Dr. Brenner just referenced, and the idea that you choose to be there, and so our coaches are able to hand a standard to our students and expect them to hold on to that. And if our students can't meet those standards that are coming either team specific or from the department, then they're removed from the team. And so the short answer to your question, do we have it in writing within our code of conduct? No, but they are a part of our individual program training rules, and it's something that we're expecting our coaches to hold our kids to.
Mark, my question is about the ticketed events at the moderate level. Are those events normally ticketed? And I guess my question is, I'm more concerned about families that may not be able to afford tickets. Would they have had, in a non-pandemic year, would they have had to buy tickets anyway? And is there anything we can do for families who maybe can't afford, 4 tickets or even 2 tickets for mom and dad to go to the event. And I don't know what the past has been, because maybe that's always been that way.
Yeah, so normally we have always required passes or tickets for any type of attendance. Could we come up with something to waive that? Absolutely. I would have to talk to the money guy at some point about what that looks like for us. Obviously, there's some big revenue questions coming into this year as it is. You know, and as we look at some of the fan guidance that our superintendent's cabinet is laying out right now, you know, what does our revenue stream look like if we're not allowing fans? What does it look like if it's limited fans? You know, our web streaming, once we get that up and running, is kind of a wild card. We don't know what the revenue from that is. So, yes, we could explore something like that. What it looks like right now would be tough to say.
Well, what you're saying is, if we were looking at this last year, they would have had to have bought a pass or have tickets to go to the event anyway.
Yes. Yep.
And my other just quick question is this just for athletics, or is this for arts, theater, music, this draft?
My purview is as the director of athletics for Grand Forks Public Schools, so I can't speak directly to fine arts.
It applies to the arts-related activities as well. It's kind of indicated in the bottom narrative. And I want to emphasize that this is a draft. In fact, I'm looking at it and even catching a typo or an inconsistency in our language. So, you know, we'll get this cleaned up and get it to you as soon as possible, but it would apply to the arts as well.
So I feel like I'm the mask police, or actually I don't know what I feel like. I got a call today from somebody who said, and you already know the story, but he'd seen Central High School football practice and nobody was masked. Coaches were huddling with students. And so, you know, if Gina Weiler, if Gina Weiler is there and everybody's masked, and then they go, whew, that's over. She's done, let's take them off. I mean, it's tough to continue to do that. So this says workouts, practices, and competitions are permitted, and I don't see in here, and football's outside, so I don't see where you're saying that they have to be masked unless they're in close proximity, which is, I think, the language that you said, but where is that in this document?
I don't believe that's in our Grand Forks Public Schools document. I believe that's referenced in our North Dakota High School Activity Association document. I believe that's what came down from our state level group in terms of being masked for coaches and for athletes. So I shared with Ms. Schaub earlier today when we were talking about this very incident. I did loop past Central football practice this morning and I saw our coaches in masks. It would be difficult to speak about an individual occurrence. You know, do coaches remove masks when they think the entire threat is gone? It's tough to say. You know, I live in the world of educationally based athletics, and so I know coaches aren't yelling at kids when I'm present at practice either. Does that continue when I leave? I don't know. But you know, we'll continue pushing information out to our coaches. We'll continue showing them recommendations. I'll follow up with them continuously, and I mean, we've got a little bit of a learning curve here for our coaches who've been doing this for a long time to get to the point where we'd like to be.
Can that be added though to this document? So that it's, maybe that's like one of those link options or something, so that it's clear that there is a requirement to wear masks.
I would think, I mean, adding anything would be possible. You know, I don't know what the concern is about a document, you know, a singular document getting too lengthy or too wordy. You certainly don't want it ignored. So, but I would think adding links or wording to just about anything would be possible.
Wouldn't it help so that you'd have something to say, this is the expectation for coaches? And I don't know, I'm certainly no expert here. It's just, yeah, again, it's interesting to me that somebody would even kind of be reporting to me, you know, that this is what they had observed. And so I'm kind of just trying to figure out, you know, what would be the responsibility of, what could the district use then to say this is what the expectation is?
Yeah, and again, we have the document from the North Dakota High School Activity Association that has been shared with our coaches. It's been followed up through my office. We do have it in writing on a document in the hands of our coaches. and it is an expectation that it would be followed through. So they do have what you're asking for, just not in the place where you're asking for it.
And Ms. Shab, I want to reiterate, Director Rarick actually heard that rumbling as well, and emailed all of the current active coaches the expectation to remind them that that was the expectation. So the report somehow trickled back, and that was reinforced. And if it needs to be reinforced again differently, I know that there's a commitment to do that, to make sure that our coaches and our students are practicing as safely as possible.
Mine too, we're all in this together, and we want to keep schools going. And so it's a positive thing. It's not a negative. It's not. Not trying to be negative. I'm trying to help out.
I'll just add to that. I do appreciate people reaching out with concerns, but I think sometimes feedback is given when there's a problem, not necessarily a praise. And so I also want to mention that I've driven past soccer, and there were some articles and news clip last week about soccer, and all of those coaches were wearing masks. And I shared with Dr. Brenner that I definitely appreciate that commitment from the coaches to wear masks. I also shared with him, I was watching a baseball game a couple weeks ago, and the umpire ejected a coach, and so the coach went back into his dugout and came out with his mask because he would have gotten fined, and so he started yelling social distancely from the umpire. And so I guess my question to you about that is, you have this document. Is it required? Is it a guideline? Because those are two different things. But let's say there's an instance like that where there's some sort of conversation happening, or during a game setting, regardless, are there requirements from the North Dakota High School Activity Association where an umpire or referee or someone in an authoritative capacity who's facilitating the game, could they say, you're not wearing a mask, coach, so you could be ejected, or you could be, we're going to stop this game or whatnot until you put one on? Do they have the authority to say that to the coaching staff?
I'm really struggling with this button here tonight. Yes, the short version is yes, anybody can address it because it's in the guidelines for this year. Could a coach be ejected for it? I don't think we'll see that. I think what you would see is somebody telling the coach to go put a mask on, and I know what you'll see from our coaches. If that coach has a mask off, the coach will turn around and put his or her mask on. I'm not, as I look at the makeup of our coaching staff from top to bottom, I'm not concerned about our coaches following these guidelines. Every discussion that I've had with them in the 2 months leading up to this, I think all of us are on board moving forward, doing whatever we can to get our kids this season. And we're going to do so, trying to keep as many kids as we can safe and healthy and ready to go. And I think I shared with the board last week or 2 weeks ago, I said, our entire goal was to get to day one. And now that we're at day one, our goal is to get to game one. And I don't anticipate that we'll run into any interference from our coaches on that.
Thank you. I do agree that this is a learning curve. I mean, you said it's 1 week and 1 day into teaching and being back in the classroom environment or setting. And so I think, we need to give grace, but ample warnings to say, hey, listen, this is an expectation. And I also appreciate the example that we're teaching our coaches, because I think then that trickles down. I don't want kids to come into our school and feel like they're constantly being watched because maybe their mask slipped off or maybe they took it off or whatnot, and then it becomes a punishment rather than let's praise people for doing the good behavior. And so I also want to make sure that we're taking those opportunities to praise coaches and staff when they're following those guidelines, because they're new and we're all in this together and we're learning together as well. So thank you, Dr. Lund.
Thank you. Mr. Rarick, recognizing as I sit here, my next is I recognize, for example, the building administrators are measuring rooms and communicating with faculty and staff and working with you. So when we look at the spectators, we're going to have students in the stands. And without going into all the details, plans are being put in place and how many students would be allowed, how that's going to be determined, what's 50%, those types of things. And again, I know there are so many things taking place by so many. Is that in the process of what that number would be for each school or visiting schools?
Are you referencing gym
Students,
capacities?
oh, excuse me, students from, let's say Red River High School has a football game or a soccer match. 50% means what for students, and who determines which students would attend?
There's a work in progress right now at the cabinet level about what fan attendance would look like. So a lot of those questions are still up in the air. For me, I'm still looking for some guidance on that. I guess I view my role right now as to take the direction that I'm given and to make it work. And so if we get to the point where there are students in the stands, we'll figure out what that number is safely, and I'll work with our building administrators regarding supervision. As I've mentioned before, I think that is one of the trickiest pieces when it comes to fans in the stands is the student piece, because as you well know, those kids are magnets. And so it's certainly one of the things that we're considering as we look through a procedure for that.
Understood, and thank you.
Mark, we have a sports crazed nation, to say. There's been a lot of conversation out there because the pro sports are in bubbles, but they got billions of dollars. You got colleges, especially footballs, that are canceling their fall season. UND got canceled. How do you reconcile? How do you comment about the difference between, say, a UND football schedule, which potentially could go to 6 or 7 states, versus the high schools? And how would you answer somebody if they're asking why would we do high school sports when universities and others are canceling their seasons? And not necessarily from just the Grand Forks athletic director viewpoint, but you're on the state stuff too. How do you answer that from the state level as well?
Yeah, so I'll start with my Grand Forks Public Schools hat on. The biggest difference between us and the collegiate model is that travel piece. And you referenced a number of states that you go back and forth to. We've done so much trimming down to our schedules right now that, our kids are going to travel between Grand Forks, the FM Metro, Valley City, Wahpeton, Devils Lake, and we might send a bus to Crookston at some point. But our travel is very, very limited to the area, to the region. And so one of the discussions that we've had along the way is sending a bus full of our kids to Fargo any different than the amount of traffic on I-29 between Grand Forks and Fargo anyway. And so we've considered the difference in our travel as compared to the difference in collegiate travel. I've also referenced the idea of kids playing sports, whether we're hosting it or not. And again, we feel like in the high school world, we can limit their travel by hosting sports. I really do believe that clubs will pick up the void if we are not hosting, and then there's no limit to that travel. We're actually seeing that a little bit in Minnesota already with the movement of football and volleyball seasons. We've seen a couple messages back and forth about fall basketball leagues being ramped up for the Minnesota football kids who aren't playing. I've heard a rumor, I haven't seen confirmed yet, that the JO volleyball leagues are going to kick back up in Minnesota here this fall also. So you're going to see wider spread club travel than you would in the school world. In my role as a board member, switching hats right now, and I may have referenced this earlier, but we just recognize the difference in travel across our state. The concerns of one of our high schools playing one of Fargo's high schools are not the same concerns for Divide County going to play West Hope. I grew up in Little Ashley, North Dakota, and I can tell you there is zero concern right now for the folks in Ashley, Napoleon, Linton, Wishick when it comes to athletic travel. When you get down into Sausage and Coogan country there, they're just not as concerned about it as we are. So at the board level, we didn't feel like any type of blanket decision was going to fit our entire state very well. So we deferred to the local schools. And so I think we in the EDC have done a nice job, in the WDA also, in recognizing that Fargo and West Fargo have been one of the hot spots throughout the course of the state, and the Burley-Morton counties have been the other, Bismarck, Mandan, and throughout our scheduling now we've separated those two, in that there won't be travel between those two communities. So we've kept our kids limited to this side of the state, as has the WDA. So I think those would be the biggest differences between us and the collegiate model. The last one that falls into place is the funding part, and I know many of you have seen that, but when the dominoes start falling in college football, it changes the funding for all of college athletics, and our funding model is so much different than that we don't have the same concern. We're not getting guaranteed game money for football. We're not paying out, and we certainly don't have 60,000 fans paying $100 a pop for 8 home games. So it's just a different model.
So you're saying high school football is not a $4 billion business like college football is?
If it is, Mr. Bergey's
Thank
having
you.
some money on me.
I wish.
About how many student athletes do we have on a yearly basis? How many students? Do you have a ballpark?
Yeah, in any given year, we ballpark about 50% of our athletes. Let me rephrase that. It's about we get about a 50% participation rate. So there's kids who play 2 seasons would count twice, but our participation rate generally follows about 50% of our student population.
So we're talking about a significant number of students when we're talking about the athletics.
Yeah, again, throughout the course of a year, and that number gets ramped up by our multi-sport athletes. We have some sports that are higher participation rates than others. In fact, 3 of our biggest ones are going right now. Football, boys soccer, and volleyball are actually, if I thought about it, 3 of the 4 highest. Track and field would be the other one. So we're going to see our highest participation rates right away this fall.
So I have a number of things that one of them was brought up last time, and that was transition time. So kind of piggybacking off of what you said about, student participation. One of my concerns is that transition time. So if I have students, let's say there's a lottery and 50 students get to participate. How do we get those 50 students to and from with social distancing, and how do we not have clustering of students in attendance? So that's one of my questions. And then the second question had to do with busing. So I know for general busing, we're needing to adjust that. And so that, I would imagine, have to be adjusted also for sports busing as well.
So your first question is about getting kids essentially from the classroom to practices? Is that
No, more like events. So if we have a football game, how do we prevent people from clustering at entryways and exitways before and after or during intermissions, those types of things?
So some of that's going to come down to where the board and cabinet lands on the number of fans that we have in the first place. We can mitigate some of that by utilizing more entry and exit points. For those of you familiar with our athletic programs, typically at each of our gyms, we have a single entry for fans to come through. We do the same thing at Cushman. We bring them in through the Eagles Tunnel. We have other places in our gyms that we could use. We typically save some dollars on staffing by paying for one ticket taker and staffing one table. So we do have, particularly on the exit end, we do have ways that we can manage flow that way. We're doing some other things just through scheduling. So one of the things I'm working on right now with, in particular, our volleyball schedule, where we'll play C, JV, and varsity all on the same night. We're going to build some extra time in between those 3 matches. And so what we'll try to do then is we'll get our fans in for the C match, our fans and kids in for the C match, and then we'll get them out of the gym and then bring JV in. Now, some of that it's a difficult proposition because those aren't timed sports. Volleyball matches have a pretty wide range of how long they might last, so we can build some space into it. What that looks like in reality is still kind of a question mark, but we're going to do that with a handful of our sports. As far as teams go, we've scheduled our locker rooms, and so we're getting kids in and out of locker rooms in groups, in small bunches. So again, trying to avoid 50 football kids sitting in a locker room at one time. We'll get them in 10s or 20s depending on the space. We'll do the same thing on again, volleyball game nights where, if we're traveling on the road, we've instructed our coaches, typically everybody would get off the bus and you'd all go into the locker room together right away, and then JV and varsity would leave while C changes down for the match. We're going to have to put a stop to that. The C kids go in and nobody else goes in. And then once C is out while they're playing, then JV can go change, etc. And then same thing after matches. So the transportation piece, some of this again is dependent on fans. So we know, and we have a meeting with Dietrich on Wednesday, I believe, and this is one of the items that we'll be talking about, because we have some serious concerns about the 3 o'clock to 4 o'clock window, when our greatest need for route busing and for special ed busing occurs at the same time that we need middle school shuttles. It occurs at the same time that we typically bus our central kids to Purper Arena or to South Middle School for soccer. And so we're gonna see a greater need for busing during those periods. As far as contests go, we're tweaking our transportation guidelines to allow parents to drive kids to games, which we typically don't do. We've typically required our athletes to ride district transportation to the event. And I'm working with our building level secretaries right now to make that process as easy as possible in the hopes that they're not getting 30 phone calls an hour before the bus leaves. But we're working on a process for that right now to allow parents to drive kids to contests. The one hurdle that we have to consider on that, if we get to the point where as a conference we're not allowing fans, it becomes unrealistic for us to ask parents to drive kids to games, in which case our busing needs are probably going to double for athletics. Our coaches, as a means of, again, limiting contact throughout all levels, we're being pretty aggressive about the numbers that we're keeping on rosters. In fact, our overall participation rate is probably going to dip a little bit this year, and that will be self-driven. We're just going to keep fewer kids on the team this year, and that'll help manage some of the transportation woes. But we do have some questions with that. For those of you familiar with our busing arrangement in the past, also we've had a non-exclusive provider agreement with Dietrich, where Dietrich essentially gets first rights of refusal before we go into Triangle, and we're going to start working with that also in the hopes that we can lean on Triangle a little more heavily, which will increase the number of buses available to us too. So we've got a lot of lines in the water right now. We're working on this in a lot of different directions.
And then my last thing was really just more of a comment. At this point, we're basically saying masks are required unless you're 6 feet apart in the classroom, in the hallway. And I would imagine that needs to extend to anything that's district-sponsored activity, regardless of what that is. I think that's just a hardcore. Cynthia, you catching the fact that wasn't mentioned in the plan? Like, I'm almost embarrassed I didn't catch that earlier, because I think it should just be a given as a district rule. And I feel very strongly that while we can talk about learning curves and how everyone's learning about new things, this is one of those things we can't really take the time and allow people to have too much of a learning curve. You know, at some point we need to say, this is the rule and this is what you're expected to do, and if you can't do that, then we need to have a discussion. I would imagine that would fall if a teacher just outright refused to wear a mask in class. Same as, you know, if a coach just kind of threw it to the sidelines because they thought, well, I'm not going to make people sweat, and that's not, you know, who knows what people think. I totally trust most of people in our district, but, you know, we have a lot of people that we staff, and there will be hiccups. So I think it's something that we need to consider is, what do we do in those situations when we have somebody who may be a repeat offender, who maybe isn't following that mask rule, because those kinds of mentorships, just as positive mentorships kind of trickle down to our students, so do the negative mentorships. And so just maybe more of a comment for administration, and maybe we have something consistent across the board, not picking on coaches, but anybody who would be doing school activities and be in a leadership role.
Yeah, I just have a quick comment on the use of busing. We've used Dietrich bus this summer for our swim program. And they are very strong at who can sit on the bus, how they spread out people on the bus, and the only kids that can sit close together are family. That's all they allowed. And we had to look at extra busing to get kids from the playgrounds to the pools this summer. So I can see us probably having to come up with extra funds to provide extra busing if we're taking a large group of kids to a event. So.
Just in terms of the overall athletic budget right now, as you look at athletic transportation in the past, I think it's also important to keep in mind that we're going to lose some historical charges. You know, we typically attended 2-day volleyball tournaments in Bismarck and in Dickinson. That's not going to happen. We had overnight golf tournaments. Those aren't going to happen. You know, we've had cross country across the state. Those aren't going to happen. And so somewhere along the line, those are going to balance out. And so, you know, our second bus for something to Fargo is still cheaper than the football bus we used to send to Williston. So there's going to be a little bit of give and take along the way here, but we are anticipating probably needing more buses for our closer events than we have in the past.
Mark, it sounds like there's two separate documents. There's the Grand Forks one, and then there's a North Dakota Activities Association one. And it sounds like if you melded the two together, it'd be too unwieldy a document. But I'm wondering, since the coaches have to abide by those state ones, if at least the school board could get a copy of those, just so we know what those are, and anybody else that needs to know that there's 2 documents out there so they can say, well, to complete the whole list, you got to do both of these kinds of things.
Yeah, I believe in our world there's actually 4 different documents and they're all pretty lengthy, but I can certainly get all of that to you.
Thank you.
I have a couple follow-up questions. So to Jackie's point, we don't delineate on here if masks are required for attendees indoor and outdoor. So I would be interested if we have a designation for that, you know, especially if people are sitting at Cushman Field, are they required to wear a mask? You know, they're technically in our facility, but.
Yeah, and the last piece is what we're leaning on with Gina Wheeler, as we talked about that, but it's GFPS facilities. So Cushman would be included with that also.
Thank you. I think that would definitely be helpful to specify, however, just indoor and outdoor GFPS facilities. Chris asked about, you know, like students attending games. And so as a follow-up to that, you know, even in level 1 in the green, it says spectators allowed up to 50% capacity. So how do we determine that? Is it we give parents the first shot? Is it doesn't matter who you are, it's first come, first serve? Is there an allotment of visitors? You know, how is that being currently discussed?
With only the exception of the Red River Central football game, and possibly even including that one, 50% of our capacity is going to cover all of our regular attendance. So at 50% for probably all of our events, that would cover our regular attendance.
Thank you. I know we're also, you know, kind of not necessarily allowing visitors per se to some of our buildings, but I imagine that there's probably some college recruiting that's still happening. I don't know if they've been cut off or what the plans are for that, but are we allowing like scouts to come in and look at practices or games? Has that been discussed?
That hasn't been discussed. A lot of that takes place video-based right now, but that really hasn't been discussed within a recruiting window right now. Thank
you. And then 2 more questions. So we talked about enforcement. Is that something where do the SROs go to the games? Are there principals that are kind of enforcing either the mask wearing or social distancing stuff? Will those staff be there as appropriate?
So historically, we use our building level principals to supervise and monitor games. I know our building level principals are really hesitant to act as mask police for fans right now, and so one of the things that we've talked about is leaning on our SROs a little bit. That, of course, is going to be an added cost and added expense for us to staff a city officer, an SRO. But we have talked about placing an SRO, particularly at ticket tables, to enforce it as people come in. Once folks are in the stands, it'll be a collaborative effort between building administrators and SROs.
I definitely think from a community policing perspective, I think it's always helpful to have them at any events per se anyways. So I think that's appropriate. And then lastly, this might be a question for you, Dr. Brenner, but I recognize that we have a lot of our facilities being used for certain outdoor activities, like or outside, you know, YMCA maybe comes in and uses our facilities, or voting at times, or, you know, other sorts of activities that kind of rent our spaces. Have we talked about how that facility usage would maybe be different this year?
Our facility rental agreements are off the table at this time until further notice.
Other questions for Mr. Varick related to athletics?
I would move we approve the plan as outlined.
So we have a motion to approve by Eric Lunn, second Bill Palmasino. Discussion. Go ahead, Jackie.
Just that with this and every plan, once we get to more of a finalized version, I know I would really appreciate maybe a hard copy. Is that something we could just maybe let Cindy know about, or? Okay.
Other discussion items? I'd just like to say too, I know that these are in draft forms, and Catherine, you kind of alluded to maybe there's some differences, and we've talked through some of this already, that we need to go back and clarify some of this, but just in reading the matrix, I think in general it's easy to digest. I would say, level 1 says community spread is at or below, community spread is at or below, and then it specifies community spread is at or above 10%. Our public health friends or state Department of Health told us that metric isn't necessarily useful as an accurate risk assessment, and so I wonder if that should be identified. And please, if I put wrong words in your mouth, please correct me. But maybe the community spread in terms of determining our level isn't as accurate for our risk assessment, and so I want to make sure that no matter what is decided in terms of how we determine the green, yellow, red, that it's also mirrored word for word in the draft plan of the smart reopening, so that the academic piece is melding appropriately with the activities piece, because even the 10% is used, and then we have 100 per 100,000 cases in our plan there. But I like how there's kind of an action item step on the other side as well. And then my last question on this is, if you look at the bottom, it specifically does identify all decisions will be made according to a 3-day positive test percentage. So again, I don't know if that's particularly clarified in the academic document. Those are good things for me to know, or for just as a parent to understand how the district is making decisions. And then it goes on to say that this is also, in terms of capacity, outlined for high school arts-based activities. So this gets a little bit past this approval piece, but it kind of has a connecting point, because while there's a fine line of arts-based activities and athletics, I also think this speaks to there are some different sports activities that may be more high risk for transmission than others. So when it comes to the conversation about cherry picking, I guess I'll use that term, I can imagine that today we're probably saying or considering, do we even offer a drama type program this year, or do we offer choir? Those are certain art-based activities that are different from one another, but still have this sort of expel of saliva in certain ways. Then you look at your plethora of athletics activities. Golf certainly seems safer than some other ones. So from an athletics perspective, from a district perspective, is it being determined that it's sort of this is a one-size-fits-all, or are we taking each individual activity as sort of its own, assessing the risk, identifying if and when cases happen that we need to pull back or whatnot? But how do you sort of quote-unquote cherry pick between, each of those plethora of activities?
I can respond to that a little bit. So this matrix, if you will, is intended to be for fans and for spectators. But we would, as far as teams that are in competition, if that's what you're asking, or activities that are in competition, we would use a similar format to make those decisions as we would for closing down an individual classroom. So we'd be working fluidly between the two documents. And I want to reiterate, and you're spot on as far as the language here goes. That's again why we're asking for some weigh-in and some support. The shift in language came after a meeting with, it's called the Institutional Partners Meeting. So we've been on weekly calls with representation from the mayor's office, the mayor himself, UND, Altru, Public Health, County Health. And one of the things that we are working towards is an ask, if you will, for the governor as far as to increase and to collaborate around testing capacity around COVID. But the other things that we're collaborating around is, can we all use the same matrix, the same metrics, if you will, to make our decisions? So if UND is choosing to close down a portion of their campus, are they using similar numbers, proportional numbers to us? Are they using the same indicators? So that 3-day rolling average language actually came out of the Institutional Partners Meeting draft suggestion. So we're going to have to get everybody really on the same page. So I think this illustrates some of the complexities of the virus and the amount of information and the number of entities that are trying to stay ahead of it and how that is ever changing. So we will get that shored up and accurate, and we'll use those documents in conjunction with one another, and also look at whether or not we want to put in some additional measuring tools as well. I think that's a good suggestion for us to take under consideration.
I can add one more layer to that, just sports specific, because we will independently identify our sports based on what happens within close contact quarantine issues. Again, thinking ahead to maybe not the if, but the when piece. It is very sport dependent. And so, you know, if 4 of our 6 varsity golfers have to miss a varsity meet, we don't have to sit out that meet. We just move 4 golfers up and we send a different 6 kids there. The same is probably true of cross country. It's, you know, it would be a lower caliber athlete, but we can still compete in the varsity competition. If 4 football starters are in quarantine, we're probably still okay. If 14 football starters are in quarantine, we're probably sitting that week out. And so, you know, we do have, it's probably a very subjective decision-making process, but we can do that independently from sport to sport.
Well, I think part of too, I could be wrong, Amber, but what you're getting at is that if the more consistent we can get with our criteria, then the less chance we have of arts being quote unquote cut versus sports. Or, you know, I had brought up last time Title IX, you know, female sports versus male sports, or any of those kinds of inequities that can sometimes happen when you're going by a case-by-case basis, as opposed to having a certain criteria that's sort of looked at and met. And so I could be misjudging where you're kind of going with that, but I know that's a concern of mine as well. I'd hate for us to change any kind of feelings we have, you know, based on anything but numbers and data. I think we need to be consistent if we can, if at all possible.
Yeah, I definitely think a good way to bridge the arts and athletics is just to have the drum line and triangles and, you know, symbols at every, you know, I mean, the band is probably going to look different now too, you know, in terms of instruments and stuff too. So I appreciate the dedication to this plan, the rolling pieces. And with that being said, if there's no questions, we can move on to a vote for the approval of the athletics plan. Okay, all those in favor of supporting the athletic smart reopening plan signify by saying aye.
Aye.
Aye. All those opposed, same sign. Motion carries. Thank you, Mr. Rare. Moving on to item D, preliminary budget and tax levy. And I'll pass on to Scott in just a second, but I do have to say, Scott, I think I saw you driving a Mustang today. I think we probably have the coolest budget manager in the state. The more and more I find out about Scott, he's just a cool guy. So I just wanted to say that. But
actually, there's holes in the floor that he's got a Fred Flintstone Mustang. So
that's probably the first time I ever heard that, Amber. So thank you. Okay, well, thank you for that, and we'll start on page 58 of the board packet. So we're already at annual budget time. School district taxes must be levied by the governing body of each school district on or before the 10th day of August, which is today. So that's the preliminary budget. Between now and October 10th, we may amend our tax levy and budget for the current fiscal year, and we would be looking at the September 28th board meeting as the time where we would conduct the public hearing for the final budget that we would ask for approval at that board meeting. But for tonight, it's a preliminary budget, and we're looking at continuing at a total mill levy of 101 mills. That's the same, excuse me, same number of mills as we had last fiscal year. Moving on to page 60 of 82, basically have laid out the mill levy again being 101 mills for each of the 2 years. Put a property valuation in there to show that if the property valuation did not change, the tax would be the same. Something similar on the next page, where I've got fiscal year 2019-20 and fiscal year 2020 and 2021. So we last fiscal year we had budgeted for 22.79 million. And the special reserve fund was new last year. We technically don't budget for that in the general fund. But if we look at the calculated amount and the collected amount, we'd budgeted for collecting 96% of the tax. Not all taxpayers pay their property taxes timely, or and some do not pay for an extended period of time. So on an annual basis, we tend not to collect 100%. We'd budgeted for 96%, and the actual came to 95.8. Looking forward to the current fiscal year, the way the mill levy was calculated last year was on a what's called a net mill levy basis, and so there's a homestead and a veterans credit which are funded by the state, and basically for the fiscal year that we're in now, the mill levy was converted to a gross mill levy, where that reduction or the amount paid by the state is not factored into that mill levy. So it does provide for a slight increase in the flow through of the taxable valuation is a bit higher because of that. So I've calculated out, as you can see under the fiscal year 2020 and 2021 year, the calculated amount. I've estimated 95% collection rate, and so what's included in the budget is a $600,000 increase in property tax revenue for the fiscal year. And again, at the bottom of that page is a property tax example based on a $200,000 market valuation. Again, showing if the market value of a property did not change, the tax would be the same for the upcoming fiscal year. Just as a quick point of note, of the large school districts, Grand Forks has the lowest mill levy. We're at 101 mills. Bismarck is 107, Minot 111, West Fargo 137, and Fargo's at 154 mills. The next 12 pages are a pretty large spreadsheet that I'll break down in the components, and we'll walk through some of the details. So starting on page 62 of the board packet, and the bottom of each page of these spreadsheets are labeled, so page 1 of 12. So the first 3 pages of the general fund spreadsheet includes 3 years of budget and actual information going back to 2016-17, as well as the 19 to 2020 budget information. Item to point out here is the beginning fund balance in July 1st of 2016, we're at 19.4 million. At the end of June 30th, 2019, we're going to be closer to the $10 million figure, so a decline of about $9.4 million. Through the course of those 4 years, the capital construction expenditures paid out of the general fund totaled $8.5 million. So the majority of the decline in the general fund balance is not due to the normal operations of the school district. It's the capital expenditures that are mill levy tied to buildings is significantly lower than other school districts. And that's the majority of the decline in the fund balance is due to capital costs being paid for out of the general fund. Let me see here. I'm just flipping pages here. So that's the majority of things on capital expenditures and general fund balance for those years. I'll flip you to page 65 of 82, and that would be page 4 of 12 on the budget spreadsheet. So here what we're looking at is the 2019 to 2020 budget, preliminary actual results, and the preliminary budget for 2020 to 2021. So we'd budgeted for expenses to exceed revenue by $5.7 million. Preliminarily, where we're at right now is a deficit of $5.9 million. There are still a few minor reconciling items out there, and likely some additional small revenues coming in to be accrued. So I think we're going to be, pretty close to that budgeted amount. Right now, both total revenues and total expenditures are within 1% of what we had budgeted for the year. Looking over to the, if I'll point you down towards the bottom of the page, there's right above ending general fund balance, transfer of 50% of the special reserve fund to the general fund. The special reserve fund was implemented last fiscal year. 50% of that was roughly $329,000. So that actually does come in and bolsters the general fund balance by that amount at the end of June, or effective July 1 is what the board approved. Looking at the preliminary budget for next year, so there's still 50% of that balance in the special reserve fund that the property tax revenue related to that will grow. So I anticipate that transfer amount that would be available would be closer to $523,000 next year, again, to help us with our general fund balance as we're spending significantly on capital expenditures out of our general fund. At a very high level, in the middle of the page, the 2020 to 2021 preliminary budget, revenues or expenses in excess of revenue, this preliminary budget, and I'll walk through some of the high level details here in a minute. But given the set of assumptions that I'll go through shortly, would be expenses exceeding revenue by $2.97 million. This does include $3 million for capital expenditures out of the general fund. Again, excluding capital expenditures, it would have been closer to a break even or a slight positive from operations. And another line item that we'll talk about in more detail as we move on here, estimated additional COVID-related costs. There's a variety of things that we know we're going to be incurring, such as PPE, potentially some additional travel costs, certainly more cleaning supply costs and janitorial hours, et cetera. What makes up that $1.5 million is roughly about $200 per student. There's a variety of, there's certainly a variety of data out there that others have tried to estimate costs. There's an association of school business officials, international, that's estimated costs of up to $485 per student. In this preliminary budget, I've got $200 in there per student. We'll walk through some of those details. And with that final budget due October 10th, we'll have several weeks of school operations in place. So again, at this point, don't necessarily have some of those amounts calculated, nor, frankly, will we, we'll have to certainly rely on some estimates as we go forward. If we had to close down one school to do a deep cleaning, there's estimates out there that could be over $20,000 in time and cleaning supplies, et cetera, related to that. So I'm talking a lot. If there's questions, please speak up as we move through this.
Dr. Schab has a question, Scott, so.
Okay.
Not to interrupt your flow there. Since we talked about hiring more paraprofessionals, I wondered about that, if that's accounted for in the budget. And then the other thing is substitutes, because I'm wondering if we need to budget for more substitute teachers because of health reasons for COVID.
So thank you for the question. The $1.5 million right now is a placeholder. I'm anticipating, the most significant categories being for cleaning supplies and the labor that goes along with additional cleaning processes that we will have, such as our electrostatic cleaning machines. That's an added layer of protection for our students and staff. There certainly will likely be some additional transportation costs, whether it be through athletics or We're still fine tuning in and working with Dietrich on our in-town, school daily bus routes and special ed routes. So again, don't necessarily have some solid numbers, but really just trying to budget for an impact of several $100,000 for multiple categories. And certainly, from a staffing perspective, additional hours from our custodial staff, and paraprofessionals in the case that Dr. Brenner talked about that that we don't have finalized yet, but having additional staffing at each building to take care of students that we need to quarantine for a time period till the parents can pick them up, et cetera. That's all in here, but we'll be able to certainly fine tune a dollar amount between now and the final budget 2 months from now. To your other question regarding substitute teachers, maybe if you want to hold off on that note, and when I hit to the salary portion, I'll walk through the details here and kind of get to it at that point, if you don't mind. Thank you. I'll hit again. There's a lot of data here. I'll hit the high points on the major components of the revenues and expenditures. At the bottom of page 4 of 12 on the spreadsheet, local source revenue, property tax revenue, anticipating to be up $500,000 over actual from the previous year. Interest income declining about $120,000 for a couple of points. Interest rates are down, and also our funds, we've incurred deficits, so we have less funds to invest. So those two dynamics will certainly see a decrease in interest income. Going to the next page, page 5 of 12, state source revenue. The majority of that is the per pupil payment provided by the state of North Dakota. We're anticipating upwards of $4 million increase from the actual results of the last fiscal year. Multiple components there. 2% increase in the per pupil payment. The per pupil payment is just slightly over $10,000 for this fiscal year. We have between the timing of the student count. North Dakota is moving towards on-time payment. However, last year we had between 125 and 135 more students than we had the previous year, but North Dakota paid the per pupil payment based on the previous September's student enrollment. So now that we're a year past that, with the 125 to 135 more students, we'll receive that roughly $10,000 per payment or per student payment for a higher student count. Excuse me, and also North Dakota is implementing or working towards on-time per pupil payments. So 50% of the funding for student growth that we will have, or we anticipate having this fiscal year, we will receive this fiscal year. So those are the major factors in a significant increase in the state per pupil payment. Now there is some risk in that number. I received a very detailed estimate from the state. If we do have, if we would say, for example, have several students that or families that elected homeschooling for their students, we would not receive a per pupil payment in that instance. So, so there's a little risk there from a budgetary aspect of the calculation, as well as if for whatever reason our demographer has been very accurate, but there's some different dynamics going on with COVID, et cetera, that may impact our student population. So while I have a very probably a 2-page document with 100 lines on it with an estimate, there is going to be some variability to the state aid payment, but this is as solid of a number as we can get at this point. And then federal source of revenue, some minor increases that average out to about 4%. So that's the revenue side. Cynthia will hit on your question regarding substitutes here. The bottom third of the page on page 5 of 12 on the spreadsheet includes salaries. And so in the middle there, for example, professional salaries, I have a $1.5 million increase. And so we're in year 2 of our contracts with teachers, principals, and directors. And so those numbers are, relatively well known. Certainly there's some fluctuation in staffing a little bit, but that's a very solid number for an increase. The para and classified category, that's the what we discussed at a recent meeting with our move to a new classified pay structure, and so that increase is built into the budget. The substitute para line, substitute other line, in the very left-hand column, you can see for the 2019 to 2020 budget was $1.579 million. Incurred was $1,020,000. When we hit distance learning in the middle of March, between then and the end of the year, we had, I know, one long-term sub, and there might have been some minor substitutes, but not significant compared to other years. So what I've done is really annualized what we had last year, and had we been in full in-person learning last year, and a budgeted increase that to $1.4 million. So that's close to $400,000 more than actual for the previous year. Again, not knowing, we have to make estimates here, but basically annualizing the 6.5 out of the 9 months that we had in-person learning last fiscal year. And so that's the salary component. Fringe benefits, the most significant line item here is that with our self-funded health insurance plan, and we haven't had high outlier utilization or whatnot. It's been relatively steady the last several years that we are going to have a 0% increase in our premium for next fiscal year. And so that's the most significant outlier in the budget is at an 8.3 to, or I guess $8.4 million, a 0% increase on that is anticipated based on our utilization. And if we do have some high usage plan participants, we do have stop loss coverage in that that limits our exposure to costs if there's some, again, some of our plan participants have high cost medical procedures or whatnot. I'll flip to the next page, page 6. Under a variety of categories here, again, supplies, equipment, furniture, all the way down the line here. There's a reduction in the equipment and furniture line. What's included in here is we have the ability to have about $2.1 million reimbursed through the CARES Act. At North Dakota, it gets reimbursed to us as an ESSER fund is what it's called. And so iPads, Chromebooks, and some other technology and some other purchases, we've submitted about $900,000 for reimbursement for those items. These are, for the most part, technology items that were on a replacement cycle for Chromebooks, for example, for our students. And what that does is it helps free up some dollars for some of these unknown COVID-related costs that we are going to incur. And so that's why there's a decrease in the equipment line. The Apple lease line, we have purchased laptops for many of our staff. Typically, that's done on a 3-year lease. And so actually the technology budget then will be reduced, well, it's reduced about a third here. In the next 2 fiscal years, we'll see a reduction in the technology budget for computer leases, because we purchased those outright to receive the work on the reimbursement. And so really through all these categories, it's adjusting, based on the data that we have, along with the items for reimbursement. Purchase services included expenditures last fiscal year for water, mold, and other issues that we had last fall with the heavy rains. Back those out for the budget this year, et cetera. Again, the most significant item on here in the other expenditure categories is construction services, which is right now placed at a $3 million line item. Last year actual was about $3.6 million. And so, as we've talked in the past, we've worked through kind of a priority list for our facilities, categories 1, 2s, and 3s, where this is not allowing us to get entirely through the category 1s. So we're, again, trying to be very judicious in our spending and make sure that our facilities are operational and safe, but it's not, we're not keeping up with that deferred maintenance with a $3 million expenditure in here. We're really limited in our funding sources at this point.
Could I ask a question? Remind me, please, what purchase services, just like a few examples? Because
purchase services can be a variety of things. When we use outside vendors that work with us. So, for example, mold remediation in our buildings, we outsource that. Say some of that to Steamatic or some other companies. It's the utilization of outside companies, for a variety of things, and there'd be, for some professional development, we sometimes bring in teachers or speakers. That would be, it's a variety of things.
So is that Edmonton or whatever that?
That may be under more in the dues and fees category. There's if it's for say like a software type item or whatnot, typically that would be more in the fees category, which is another large category that we have on this page.
As we move to more on-time funding from the state, when do they kind of take that snapshot for enrollment? Is there a particular month that they look at? Is it the same?
Just turned my mic off. It's date in September is when we look at it. I can't remember if it's September 10th or September 20th, but it's September, within the first few weeks of school starting.
Thank you. And then my other question was, and I'm guessing this falls under the federal funding, but how has it looked with COVID in terms of looking at child nutrition and kind of the costs that have either increased for us or maybe we've gotten more funding due to that? Can you speak to that a little bit?
Certainly. So what we're looking at is the general fund for our school district. Child nutrition is a separate fund. And so there certainly were some challenges when we went to remote learning and the meals that were provided, the 2 meals per day, et cetera. The reimbursement on that was not as high as if we had been in person in our classrooms. So the our fund, child nutrition fund, took a slight hit, although there's a positive balance there. And looking forward, a lot of it does depend on if we did go into a situation where we had an extended distance learning time frame. There could certainly be some impact there, but I think a lot of that from the funding would come down to what would the federal government do in, I guess I hate to say round 2, but if there's a second extended distance learning time period, there's a lot of unknowns on the funding side of things.
Can I ask a follow-up to Jackie's point about on-time funding? Dr. Brenner, I know we're still waiting on some preliminary survey data, but do you have any indication of how many individuals have chosen to enroll their child in homeschool services?
We don't know that yet.
And I guess I'll keep running along here. Utilities. Again, last year was an outlier with utilities as we went to distance learning in the middle of March. Utilities certainly declined. As buildings were empty and we reduced heating costs, et cetera. So I've really built those up again to look at the year before and then apply an increase to that. In determining that. The yellow box at the bottom really talks about the COVID expense. At this point, $200 per student, transportation, personal protective, masks, et cetera, cleaning supplies, custodial and other staffing needs. If we enter an extended distance learning time frame again, that would, there's impacts if we don't have work for, some of our classified staff, et cetera, from a different direction. If athletics or, as we've talked tonight, athletics, music, theater, spa, if there were things there that impacted the ability, for those areas to operate fully or partially, there's impacts there. So, a lot of things to wrestle between now and our final budget for early October. With the $1.5 million that is built into this budget, that does add to the deficit. What we also have, looking forward, is that there's an additional $1.1 million in ESSER funds that are out there for reimbursement purposes. And so we're looking at Chromebook and other technology renewals for not this fiscal year that we're in, but the 2021 to 2022 fiscal year, where we will be able to capture reimbursement again, and a lot of that being technology related. But what that'll do is reduce our technology budget and other budgets for reimbursement for that fiscal year. So really there's a timing difference where if we're applying $1.5 million of additional expense COVID related right now, the following fiscal year we would be able to reduce our budgets by about $1.1 million to offset the majority of this. Now if we do, if we were to hit that $400 to $500 amount per student with COVID costs, we're looking at $3.5 to $3.75 million. The $2.1 million of COVID costs doesn't cover anywhere close to that. And so that's kind of the big, the big question that we have right now. What are we going to incur, significantly more costs? Are there grants out there? Is there additional federal funding out there, which there are bills out there, as Mr. Thompson mentioned, but nothing concrete at this point. So at this point, we'll with the final budget, we'll have several weeks of actual activity under our belts, and we'll be able to provide, I think, a better estimate. And again, we're working with transportation contracts. There's a few things we don't have the final answer for. Then the next 3 pages, so we'd be looking at, let's see here. Page 68 of 82. That's really just provides multiple years of budgets next to multiple years of actual results. A lot of that I was trying to use for trending purposes, and for yourselves, it's somewhat interesting to see how things the impact of those. And one thing I do want to highlight here, and again I know this budget is due before midnight, so I do not plan on keeping you here for the next 3.5 hours. But I do want to point out a couple more things here. On page 70 of 82, the very bottom there is revenues in excess of expenditures, excluding construction expenditures. So the right half of this page starts at the year 2016 to 2017. If we look at the first 3 years, the 2017, 18, and 19 years, if we back out the construction expenditures from our actual results, we would have had an increase in our general fund balance in each of those 3 years. It's, again, that the construction costs that are impacting our general fund the most significantly. The 2019 to 2020 fiscal year, we would have had did have a deficit excluding the construction expenditures. We're working on, just look at my notes here, some of that water and mold damage that occurred last fall. We've had submissions to FEMA. One is for roughly $70,000. That's almost fully through the process, and it looks like we will receive reimbursement for that. So, so I do anticipate that we will shave off some of that gap for last year. And again, a lot of that came down to timing with increase of students, say 130 students, but we didn't receive any reimbursement from the state last year, so there's a timing difference. The June 30th of 2021, the preliminary general fund operating budget, again, would be a slight positive if not for the capital construction needs and anticipated COVID costs that we'll have. So again, we're doing our best to operate within our means. It's really the outliers of the pandemic environment that we're operating in, as well as the deferred maintenance that we are trying to chip away at that are really driving the decline in the general fund balance. If we want to talk just briefly for the mill levy related to facilities, we have 12 mills tied to building and sinking fund. The next smallest school district, or the next large school district with the closest mill levy to us for building and sinking funds is Minot at 23.5 mills, almost double where we're at. So if we just take that 11.5 mil difference, 1 mill in Grand Forks is roughly $250,000. If we were at the mill levy of Minot, that would be $2.875 million more per year. That it would offset nearly that $3 million that we have in for capital improvements. And so Minot is the next closest to us. So we're at 12 mills. Minot's at 23.5. Bismarck is at 32.82. Fargo's at 27.35. And West Fargo's at 53.98, and we're at 12. And so I guess I hate to keep hitting on this, but from that, the impact on our general fund of the construction expenditures is due to Grand Forks School District having a significantly lower mill levy than all of the other large school districts in North Dakota. Just about done here. The pages 71, 72, and 73 are, again, more just as a reference showing budget growth on an annual basis and actual growth in revenues and expenses on a annual basis and a percent change. Again, just to show some trends, which I think it's important to look at, things. Each year you have to take on its own, but certain things, there are trends, and particularly last year with 2.5 months distance learning, some of the items we couldn't just take last year's actual. We kind of have to look at kind of a rolling average and apply some estimates to that. I will not go through pages 74 through 82 in depth here. What that is it's the certificate of levy. what we have here is the preliminary certificate of levy based on all of the numbers that I put together for the budget, for the preliminary budget. And that's the document that is signed and sent to Grand Forks County, again, pending approval by the board. So I've hit you all with a lot of numbers and 30 pages of information. So whatever additional questions I may answer, if I skipped over anything, please let me know.
I just want to say, Scott, that I feel like I've learned a lot from you, and you helped me to kind of move from maybe some higher level thinking about budget to more specifics just by the way you explain things. And so I just wanted to give a shout out that I really appreciate the way you discuss the budget.
Thanks.
I may have missed it, Scott, but where do we expect the ending fund balance to be in 2021? Not this year, but 2021.
Dr. Lunn, you mean like a year, next June?
Correct.
Yep. Bear with me a second here. That's one thing going through the numbers I didn't point out. Let's see if we go
I think
to.
he was the only one. So
yeah. If you would go to page 65 of 82, about 2/3 of the way down the page, I've got in all caps ending general fund balance. We would, so if we do incur an additional $1.5 million in COVID costs, we would be at about $6.2 million as a ending general fund balance, which equates to about 5.5% of total expenditures. Our auditors and somewhat of a rule of thumb with school districts is you would like to see the ending fund balance equal between 15 and 18 to 20% of total expenditures, and we'll be at about a third of that is likely where we would be at. Again, the majority of that being construction costs paid through general funds is what's driving that. Operationally, we would be able to maintain that certainly, but between that and additional cleaning and staffing costs that we would have related to cleaning and potential help with nursing, et cetera. That's what's driving that big gap there, Dr. Lund.
thank you. And I think the word on the educational side is flexible. I think we're going to have to do that on the financial side too, because there's just so many unknowns this year.
Yeah. The other huge component to this is, I'm always looking, or as a district, we're always looking beyond, not looking at just 1 year at a time. We're looking at multiple years. And so the biggest thing coming up is, of course, the legislative session. They start meeting in January, between January and, typically, April 10th or April 15th or so. And the education funding bill is always the last bill passed by the state legislature. So, there's a lot of unknowns between now and next April for funding for the following fiscal year, given where oil prices have been at, and I think this year up to 2 million acres of crops were not planted. So there's a variety of components out there that we don't know for that following year from a funding source from the state, which is about 2/3 of our revenue, and then also at the same time. We work with teachers, principals, directors, et cetera, on a contract for the following year. So where certain things were relatively known for this budget cycle, as much as can be, next budget cycle, there's the major components of our budget. Revenue and salary expense are, those are the huge components that we have to work through, and in some cases wait on the state to see where our funding will end up.
Other questions for Scott? So can I get a motion to approve the preliminary budget and tax levy? Doug, is there a second? Chris? All those in favor signify by saying aye. All those opposed, same sign. Motion carries. Any announcements? Go ahead, Dr. Brenner.
Yes, Madam President, I just have two quick ones. Just a reminder that COVID testing is available for all staff and for school board members this Friday at the UND High Performance Center starting at 10 a.m. in the morning. And we're not limited to a 1-hour block, but we know we have the morning for sure. But the day really is reserved for Grand Forks Public School staff. So it's not mandatory, it's voluntary, it's optional, so we hope you all can attend. And the second announcement, the Facilities Task Force will meet again this Thursday. They will be touring Schrader Middle School and Viking Elementary School. That's what I have.
Dr. Brenner, you have a couple of appearances this week. Do you want to mention those at all? Or the Wednesday specifically one?
Sure, thank you. One was pretty much well finalized on Friday. Tomorrow at noon, I'll be doing a Q&A with Informed Communications, and if I find that link for you, I will send that out before noon tomorrow. Apparently, some questions that the Herald, basically, or Informed Communications, has asked the public to weigh in with some questions that might be helpful for me to respond to help with whatever the community or whatever parents need to know about back to school. And then on Wednesday, and I'm sorry, I'm not sure what time this is at, if it's at 2 or 3 o'clock, I'll be part of the community city live stream. I think that involves the city, school district, probably UND, and I'm not sure who else will be part of that. 2:15 on Wednesday. Thank you.
Other announcements, Cynthia?
Diversity Task Force meets this week as well, I believe.
Thursday at 3 o'clock.
Are we meeting next Monday?
I would ask you just to tentatively hold that on your calendars, please, and we'll let you know by Friday for sure.
Other announcements from anyone? I'm going to echo the message that's been put out by Public Health in the city, just as precautionary measures to us and to the community to continue to practice good hygiene by washing your hands, wearing a face mask, avoid touching your face, covering a cough or sneeze, disinfect high traffic areas, and stay home if you are not feeling well. Melissa, did you have any announcements about anything or comments? Okay. Any board requests for future considerations? Okay. Chris, school board norms review, how do we do?
We did rather well, and we're going to be done under 3 hours.
All right. That means we are adjourned. Thank you.